Julie, a 38-year-old mother of two, noticed the appearance of a freckle on her lower back over the course of several months. Melanoma was her diagnosis. Julie died 2 weeks after seeing her dermatologist for a spot that she believed could be cured by a simple antibiotic cream. While we do not know if Julie used any form of sun protection, we do know that sunscreen is one effective method of protecting ourselves from burning and reducing our chances of developing skin cancer. The main points that I will be explaining is why we should use sunscreen as a form of ultraviolet protection, what to look for when purchasing a sunscreen, and the proper technique to apply the sunscreen to ensure its effectiveness. First, it is important to determine why sunscreen is necessary. The sun emits ultraviolet rays which we expose ourselves to when we were outside during the day, even on a cloudy day. Ultraviolet radiation is explained by the National Toxicology Program as being divided into UVA, UVB, and UVC rays. The rays reaching the equator are 95% UVA and 5% UVB. UVC rays do not reach the Earth's surface because they are absorbed by the ozone layer. Sunscreens use various chemicals and blockers which are believed to protect our skin from many of the UVB rays and some of the UVA ones. The longer that we expose our skin to this radiation, the greater our chances of developing skin cancer, as the radiation produces genetic mutations in the cells of our dermis, which can lead to melanoma, a deadly form of skin cancer. It is estimated that in 2010 there will be more than 68,130 new cases of melanoma and over 8,700 related deaths. The American Cancer Society reported in 2009 that skin cancer is the most common form of cancer in the United States, with more than 1 million skin cancers diagnosed annually. This is more than breast, prostate, lung, and colon cancer combined. It stands to reason that to reduce the risk of cancer, we should simply avoid going outside during the day. However, this isn't reasonable for most individuals. The second point concerns the many different sunscreen products on the market and how to recognize the differences in these products to choose the most appropriate one. An area of confusion involves the SPE factor that we read on each bottle. These numbers range from 5 to 100 plus. Dr. Linder explains in her article in the Skin Cancer Foundation Journal that the higher the SPF number, the longer the skin coated in sunscreen may be exposed to ultraviolet light before it burns. An SPF of 15 protects our skin from 93% of UVB rays. An SPF of 30 protects approximately 97% of rays, and an SPF of 50 protects close to 98%. Anything over an SPF of 50 does not provide much more protection, as sunscreen does not block all ultraviolet rays. We must also look at two formulas and their ingredients to make an informed choice in our purchase of sunscreen. Virginia Culler reports in her paper at Bryn Mawr College the difference between physical blockers and chemical absorbers, which are the two types of sunscreen formulations. Titanium dioxide and zinc dioxide are the active ingredients in the physical blocker and work by absorbing the ultraviolet rays. Parsol 1789 and PABA are found in the chemical absorber, whose role is to reflect and scatter the ultraviolet rays. Culler concludes that the physical blocker is more effective at overall protection from ultraviolet rays. Finally, in order for the sunscreen to be effective, it must be applied properly. Dr. Linder explains that an ounce of sunscreen should be applied to the body. This equates to 1/4 of a 4-ounce bottle or tube of sunscreen. This is how much should be used for each application. Sunscreen needs to be reapplied every 2 hours or after 40 minutes of being immersed in water, according to Dr. Linder, and should be applied at least 20 minutes prior to sun exposure, which allows the lotion to form a film on the skin. The unfortunate ending in Julie's story can teach the rest of us a lesson in taking responsibility for protecting ourselves from the sun's burning rays. A simple application of a lotion applied prior to sun exposure may prevent us from experiencing a devastating blow at our next dermatologist appointment. After discussing the reasons to use sunscreen, the ingredients to look for in a sunscreen, and the proper manner in which to use such product, it is evident that everyone should take precautions if one plans to be exposed to ultraviolet rays. While not all cases of skin cancer may be directly related to the lack or improper use of sunscreen, we can reduce our risk by protecting our skin. On a final note, stay sun smart. This was the campaign slogan for the Skin Cancer Foundation in 2009. Thank you for your time.